All right. Hello, everyone. Welcome to Exposed Healthcare. My name is Steve, and I'm going to do one of my things that I've done before where I just go through my LinkedIn feed and just talk about what I'm looking at. So, what do you have here? Following a series of walkouts by pharmacy workers, by at CVS Health and Walgreens, organizers, including Shane Jermonski, have formed the Pharmacy Guild, a group meant to help unionize retail pharmacy employees. We're speaking out to help frontline pharmacy professionals organize a national union and also trying to organize a group that's really keyed in on the problems facing community pharmacy, retail pharmacy. I've talked about this before. I know Shane Jermonski, really good guy, accidental pharmacist, and he's working with a few different people on this. Um, yeah, so definitely super supportive of what they're doing. It's great. Um, Definitely much needed. Much needed. Boston Scientific Cardiology, great. They're great. Okay. Another milestone on the books. VA has now screened more than 5 million veterans for toxic substance exposures across the country. Since President Biden signed the PACT Act into law, we have offered more care and more benefits to veterans than ever before, including an all-time record of 116 million appointments delivered this past year. At many of these appointments, we have screened veterans for exposures to substances like toxic burn pits, Agent Orange, and more as they deploy to defend our freedom abroad. Every veteran who screens positive is offered exposure-informed care, and now every provider who sees them will be aware of that exposure, its potential relationship. My thing is, I definitely support us doing this for veterans, but this should be done for all Americans. All Americans should be have access to different toxic substance exposures like lead and other things that's in our water, in our air, and then by collecting that data, then we could do something about it because there's definitely areas of our country that still have these problems happening. All right, Bled Tenau, founder of Pizza is Not Working, also one of the leaders of the Pharmacy Guild. Zeal without knowledge is dangerous. By now, you've probably seen this. I know many of you want my opinion about those changes. I will say my thoughts are complicated. This is the best way I can explain it. You see, I always tell my technicians that I need them to be more than warm bodies. I need them to think clinically about their roles because it is clinical. The expansion of technician roles makes a lot of people uneasy and excited, and rightly so for both opinions. I am for the expansion for any roles, pharmacist technicians, as long as it comes with proper training, conscious liability, proper infrastructures for support, and ultimately increase in pay. Those are not negotiable for me. Again, zeal without knowledge is dangerous. So for me, it will be beneficial in my role as a national advocate to know more about how and why this came to be. Who were the supporting or the rejecting parties? What details we need to have before forming an opinion? What all does it say it actually entails? Let's dig. I would like to hear from Association Pharmacist Technicians, students. Where do you land on this? Oh, this is for final. A limited pharmacy technician license may provide final product verification. 1,000 hours required to provide final product verification may be acquired by a limited temporary full license or a student. The requirement that a pharmacist is fully responsible for remote technician practice accuracy was deleted. So, yeah, there's something called tech checking tech, which is common in some states and hospital settings. And I agree with Bled. If you're going to add that liability, you need to add the pay for sure. You got to pay for that responsibility. You have to have proper training. You have to have enough support, infrastructure. The computer system needs to work well. So definitely support you, Bled, on that as usual. Okay. Okay. Let's get one more in here. Keep it short but sweet. I'm adding a new term to the healthcare dictionary, APC, Advanced Pharmacy Care. What's APC? Personalized clinical consultation provided by a community pharmacy. No agenda, no permission needed. This is especially valuable when you have multiple conditions you're dealing with. By closely reviewing medication plans, we've been able to offer cost-effective alternatives without compromising quality. We'll even pick up the phone and talk to your doctor if it can help you save money. When you're dealing with the owner of a business, you'll see a noticeable improvement in service, as these dedicated pharmacists are always looking for innovative ways to enhance patient care and steer patients to better outcomes. This is just one example of how community pharmacists are committed to making healthcare more affordable and accessible for everyone. Um, yeah, I'm cool with that. It's interesting because in some way there that does exist through MTM, medication therapy management. However, it's often not done properly, and often it's set up in a way that it's hard to actually bring that value to the patient, even with that payment that allows you to do these certain things. Um, there definitely needs to be a lot more payment for clinical services. The amount of time that pharmacists spend talking to patients and bringing value, whether it's getting a coupon or switching a medication, even if there's a drug interaction, the pharmacist is doing something about it. That work should be paid for, because sometimes it takes a long time to get that figured out, calling the doctor, and multiple times if there's a drug recall. I've had that happen before, where a drug recall happened, and I've had to call the doctor many, many times, and it's just it takes so much time. You're bringing value to the patient. That should be compensated. So, hope you like what you saw here, and would love to know your comments about it.